I'm Fiona Wood and I'm a surgeon at Fiona Stanley Hospital. For your surgery, there are 3 things that I'd like you to understand. Firstly, consent, and why it is so important for you to understand what is about to take place. Second, what you can do in helping with your own healing process. And finally, what we will do to help you get back to your normal life and get you back home. Before your surgery, surgeons will always ask for your permission in writing. We call this whole process consent. We will provide you with information about your medical condition, the benefits and the risks of surgery. It's vital that you understand this information to tell us if there are any problems with it or if something doesn't quite make sense. Once you understand the risks and benefits, we will document your approval. This will be on a consent form or it can be done digitally. You are still in charge, and at any point up to your surgery, you can withdraw your consent and ask for more information if anything or something is worrying you. Performing the surgery is just one part of the whole healing process. There are risks that come with any procedure, but to some extent, how you recover from it is in your hands. Infections remain a serious and sometimes even life-threatening complication from surgery. Smoking and certain medical conditions and poor circulation can also slow down your healing process. We are always on the watch out for these to help you. Smoking can absolutely increase your risk of infection, sometimes between 2 and 4 times. Quitting smoking as early as possible before your surgery will improve your body's ability to heal. We'll support you in your quest to quit. Our teams want to keep you safe throughout the whole surgical journey. After your surgery, you may need to stay in hospital until you're well enough to go home. Our goal is to get you home as soon as possible. You should make it your goal as well, because the longer you stay in hospital, the higher your risk of developing a complication. Complications such as blood clots, wound infections and chest infections. Following your team's recommendation to get yourself fit and ready for surgery is the first step. Even before you come to hospital, you can better your chances of being able to go home sooner. Beware that you may be restricted in what you can do after surgery. This includes activities like eating, walking, driving, lifting, and getting back to your work and hobbies. Your team will discuss these with you and how it may impact on your life before surgery as well as after the anaesthetic has worn off. It's important that you observe these recommendations as they are there to avoid a slower recovery. We always want you to heal as quickly as possible. The recommendations protect you from coming down with infection or injury or going backwards in your healing process. Your surgeons and the entire team, the whole perioperative team, want you to achieve the best possible results from your next surgery. You and your family need to prepare you for this surgical journey. And watching these Fit for Surgery videos is the first step in that process.